Hey, good morning.
Morning.
We are starting our new program called Young Entrepreneurs Building the Future of Business. And with me, our co-host, Juliana Snyder, owner of Combat 360. Hi, Juliana. How are you this morning?
Good. How are you doing?
I am doing fabulously well. And our topic, as you know, that we are discussing young entrepreneurship and how the future of business will be built by young entrepreneurs. And we have someone as a guest with us. And would you mind go ahead and introducing her first?
Yeah. So Shannon, is a very highly skilled and um, expert in COVID. So she's going to be talking to us today about COVID and her experience around the world and helping set up clinics, and also about her maybe new venture into doing some consulting as well. So yeah. So go ahead, Shannon. Can you just share a little bit about yourself and your background?
Yeah, hey, good morning. My name is Shannon, and I am a physician assistant. I've had about 10 years of working as a PA in the ER here in the St. Louis area. And then in 2018, I joined a disaster assistance response team, so an international humanitarian organization that has expertise and many years of experience in doing disaster response, that may be to responding to natural disasters, as well as a lot of experience responding to infectious disease outbreaks. They responded to cholera, diphtheria outbreaks, and Ebola outbreaks as well. And so got some additional education certifications in international medicine and public health. I'm as well a fellow candidate in the Academy of Wilderness Medicine, just kind of some preparation for practicing a really different kind of medicine. And last year in 2019, I got to deploy with the team to the Democratic Republic of Congo. I'm sure, you guys probably heard in the news, there was an Ebola outbreak throughout the Democratic Republic of Congo. It was last April that the World Health Organization declared that a pandemic of international concern as well. And so got to respond to that. And then this year, of course, we all know March brought a whole new world to most of us. And so our team, as I mentioned, was an international team. And then all of a sudden in March 31st, we deployed to New York City. And so our organization got some trucks with our hospitals up to New York on March 31st. And by April 2nd, we had opened a field hospital in Central Park. And so that was obviously a very unexpected experience. When you are running a disaster deployment unit and medical field hospitals, you expect to do that in the Congo. You don't expect to do that in New York City. And especially in the middle of Central Park, to be setting up a field hospital. And so there we ran a 68-bed hospital unit, tent hospitals that, like I said, were set up in Central Park. We were in partnership with Mount Sinai Hospital, and that really enabled that. So it was what we called a respiratory care unit. So I was one of the medical directors for that hospital. And we were essentially offloading COVID patients from these overrun hospitals. One of the questions a lot of people have asked me is, was New York really as bad as everyone said? And the answer is yes. The hospitals were incredibly overrun. People were sitting in the ERs for days because there was nowhere for them to go. All the ICU beds that should have one patient had two patients. And so it was really important that we were able to help offload some of those patients. One of the nurses I talked to one day about a patient we were receiving, it was, just a really experience that sticks out in my mind, just speaking to her about, she was so calm and collected. But I was asking her some questions about the patient we were receiving, and she just kind of had to finally sigh and say, I don't know that about that patient. I have 17 patients right now, and she had 17 critically ill COVID patients, where a nurse is normally responsible for 4 to 5 patients is a safe number. So it was at that time, New York was incredibly overwhelmed. As an organization, this response required a lot of innovative adaptation from us. And I know that's something that Juliana, as a young entrepreneur, you're really focused on. How do we innovate? How do we adapt to these new circumstances? And I think COVID has required a lot of that from all of us. I mean, it certainly required a lot of that from us as an organization. We had never responded in the US before. And obviously there's a big difference in practicing medicine and running a field hospital in a remote area of, say, the Congo or Bangladesh, some of these international areas and countries that we had been to before, versus working in New York City and just operating, of course, within the legal system of the U.S. and what does that look like, and providing that level of care and meeting the expectations of American medicine. And so thankfully, we had a wonderful, wonderful partnership with Mount Sinai Hospital, just a really impressive and adaptive organization. And they were ready to do whatever it took to meet the needs of their city and of their patient population. And so they were really able to provide a lot of the framework and legal background of operating a hospital system in the US. And so we were able to just, step into their framework and adapt, use our experience of disaster medicine and combine that with their experience of how do you run a hospital here in the US. And the other big thing, that I thought about that really required is a lot of adaptive and innovative leadership, because our staff was facing a very different set of challenges as well. If you think about being, medical staff, practicing again in the US is very different. There's this whole, liability framework, and people were very, very nervous. You could really see the high stress level on the staff. It's really different as well facing a disaster in your own backyard as it is going to another country to help others versus the disasters right here. And, you're going to a field hospital in New York, but your family and friends back home are facing the same problem. And so, very high stress levels in the staff, just dealing with medical concerns about medical liability, concerns of how is my family doing back home, just the difficulty of seeing what was happening right here in the US. And then as well, we're treating a brand new disease. And I think in medicine, we really like to walk into that patient room and know what we're dealing with. And we know if I do, A, B, and C, I can change the course for my patient. I can keep them safe. I can meet the standard. I can do what's right for them, and I can improve their condition. And when it came to COVID in March and April, we didn't know what A, B, and C was. We're figuring this out collectively as a medical society around the world. And it was very hard seeing these incredibly sick patients. Oh, sorry, guys. I just got a phone call. I apologize for that.
Well, very, very nice to welcome you today in our session. And one of the things I will say is, and I'm pretty sure Juliana will agree with me, is, we like to thank all our healthcare workers, all our heroes out there who've been doing such a great work, not only saving us from COVID, but also protecting the community and building this quickly doing, and we know New York City has a lot of challenges and they build a lot of hospitals very quickly. And these healthcare workers, including yourself, jumped into action and helped us through this 2020. And now 2020 is over and we are looking at 2021. So Juliana, do you want to add something to that?
Yeah, so we appreciate your work and everyone else who helps in COVID and, police and fire and all the other medical people as well. So everyone doing the work to get through 2020 and helping, make things a little bit more palatable for everyone else. Can you talk a little bit about just like your, I guess, some things that you've learned about COVID and how that maybe can help small business owners as they try and reopen their businesses?
Yeah, so definitely. So that's what I think, like I was saying, just talking about the adaptation that it required for us as a disaster team and an organization, I think that's really key, right? Is that we have to be willing to make these innovative adaptations, just like we've had to do as a medical community. It's the same with the business community. I was really, lucky in that having the experience working with Ebola last year, it really provided this framework for me. Ebola is obviously a big primer in infectious disease, PPE, all those things that, those big buzzwords you've heard in the news about dealing with COVID. And so I was able to, take that foundation and apply it to working with a new infectious disease, COVID, and just all those principles. And a lot of those really are applicable to the business world. I think we've had a lot of questions about COVID over the last few months, but we've learned a lot now too. And we really know, what those basic principles are of preventing the spread of COVID, right? You've all heard, we need to mask up, social distance, stay home if we're sick, and those things. And so I think just businesses finding those innovative and adaptive ways, your staff is going to have increased stress. Like, how do you provide leadership in that? And then the thing that I would really encourage businesses, as I see, coming back after New York, I did some advising and consulting in other parts of the US as well as Africa for hospital systems and clinic systems on these things. And the biggest thing is the willingness of leadership to really create a culture of that adaptation and safety. And I think mixed in that a mindset of service, right? So we have to look at, how can we adapt our current service model to be safer, and then have leadership that really sticks to those protocols. Because what I've witnessed a lot is people, they'll make protocols. It's easy to go in and say, how do I social distance my staff or my clients? How do I create that safety? But then I'm not really stick to those protocols and not really maintain that safety level. And so just having a leadership model and style that I think really sticks to the safety protocols we create, and creates that mindset of service among your business that says that, hey, we're going to serve our staff, we're going to serve our employees to the highest level possible by really sticking to these safety protocols. And then I think the final thing, that can be really helpful is it's a confusing, almost minefield of trying to keep up with the new information about COVID and how do we apply it, which is going to be really unique depending on what your business is. And so seek expert advice, from someone who can download that information for you and help you figure out how it applies to your context.
Very, very nicely said. And, I like the phrase you used called mindset of service. Juliana, what do you think about that?
Yeah, I think that's definitely very high on priority these days, especially with COVID. But also just in the last several years of where we see companies going towards more of a customer focus, that drives a bigger target audience. We see that in the marketing strategies, the inbound versus outbound marketing. That's one of the key things is, keeping that customer at the focus and serving them well. So I think that really applies here again to the COVID situation. As Shannon mentioned, and just doing what's best for the employees and best for the customers.
Very nice. And I know you have done some work on customer focus approach, and you have done some research on that. And this mindset of service that, this is the first time I'm hearing it from Shannon, that I think business world should grab and kind of use that on a regular basis, because that's a fantastic thing to have. And I'm pretty sure you are doing some consulting that you can use this and spread the good words around the world, because now you are traveling many places about this mindset of service, because we do need to develop that. And the more we develop that, the better it becomes. And in the center of it is what Juliana is talking about, is the customer focus. So customer is in the center. So Juliana, do you want to add to that? Do you want to talk about a little bit about how you're putting the customer in the center? Here, Shannon is talking about serving the mindset of service where staff, employees, communities, and anybody that involved is getting is in the center. So how do you define that as a customer focus?
Yeah, so I think again, like it's very prevalent around today's society of being customer focused, especially here in the U.S. We see, you know, Amazon as really a model for that, where they have the flywheel and it's continuously moving, but it's driven by the customer. So it's very customer centric. We see other brands that are, you know, very strong, and they're very strong generally with customer service focus. You know, Chick-fil-A is also a very big customer focused company, and you know, they're super successful as well. And so I think that's really important just to keep that mindset, because that is where the market is going towards. And when you're not being customer centric, you're not focusing on that customer, you know, then that's where maybe customer feels unsafe during COVID, and you know, maybe your employees aren't you know, feeling safe either. And so that also infiltrates the clients or the patients, whoever your customer is.
Mm-hmm.
And I think that's, you know, important, making sure they feel comfortable, especially in this environment. And maybe Shannon can talk to us a little bit about like maybe how we can, you know, make our clients feel a little bit more comfortable while opening our businesses, some practical ways that we can do things, and kind of like maybe why we're doing them too.
Very nice, very nice. And you know, this episode that we are doing is young entrepreneurs building the future of business. And Shannon, you are bringing this in a global perspective, because you are going into multiple countries and spreading the good word out there about the business and how we will shape the future of business. And many of us who are much older than the young professionals or young entrepreneurs will not be there in you know, 30-40 years from now, but many of you will be. So just with that perspective, the future of business will be shaped by you and young entrepreneurs. So how do you bring that global perspective with a mindset of service, and during in a pandemic that is happening all over the world, and it's a global scale? So how do you do that, Shannon? What are you doing? And you mentioned many of the things, but what would you advise for people who are newly coming into the business, who will be building the future? Can you hear me, Shannon? I think Shannon is.
I think it might be frozen.
Yeah, maybe it's an internet issue. Juliana, you want to continue that discussion?
Yeah, so I mean, Shannon can definitely speak more on the medical side of things, and you can reach out to her. Probably put some information on the website or Facebook regarding her contact information if you want more information about particularly your industry or your business going back to business and safety. In terms of the global mindset, from a customer focus, we see that, you know, that trend starting here in America. It's also a cultural thing that's, you know, going. It should always be the focus, no matter what industry that you're in or what company, what country that you're in. It should always be a focus. We see that Amazon maybe wasn't as customer centric when they went to Asia and opened up their Amazon business there, because they didn't understand really that culture as well as here in the US. And actually, many times companies are actually more profitable in the country that they are from, so domestically, as opposed to going international. And so if a business wants to go international, I think it's extremely important for them to know why they're going international and to make those objectives clear, because a lot of times it isn't profitably better off for them initially, and even just in general. So you have to know what you're doing if you're going to go into that other space. But a key component of that is being customer centric and knowing that culture, knowing your customers, what they like, what they don't like. That is extremely important.
Very nice, Juliana, because one of the things happened here, I think we lost Shannon due to internet, and that's the challenge we have, or she's coming in. So I'll admit her again. So as she join in, that's a good topic to discuss about what to do in global. And at the same time, you mentioned about profitability, because
Mhm.
business is for making profit. And if
Right.
there is no profit, there is no business. There
Yeah.
is, of course, there is the not-for-profit organizations, but if you look at focus on business, you have to make profit. And if you make the profit, you can do a lot of social good, and a lot of
Mhm.
social good will happen, and with the revenue that can be shared. Shannon, welcome back. We lost you
I
for some reason, but we continued the discussion. So we were talking about the service in a global scale, and how the young entrepreneurs who are just getting into the business right now is going to take that frontier, and how they will build the future of the business, and where we, the people like my age, can help to do that. Because there will be time we will be, my age tells me that I will not be there 40 years from now. Possibly I will, who knows, but that will be too late for me to build future by then. But you guys going to be there, and that's why we are focusing on and doing this episode of building the future of business using our young entrepreneurs. So we were talking about the global scale, and you have traveled many countries, and you have seen some global scale of this pandemic and the impact of that. And we were looking for some advice from you. How do you think the young entrepreneurs play the role in this global environment with when everybody is having a shared experience?
Yeah, well, I think, that's one of the interesting ways that obviously the pandemic and what's happened over the last year is going to change, the face of the way we do business and service in many ways. Yeah, just as it's changed the face of medicine. And I think one of the really great things is it's opened the door for us to get creative and new ways of connecting, right? And so obviously I think that's going to be really important as we move forward. As we were talking about before I got cut off, what are some of the ways that we need to, connect and change and do that. And I think one of those really important ways is, continuing to adapt our business models to, sick employees are able to stay home, and how can we do business in a safe manner using technology. And obviously that applies in a huge way to the global scale, because as we're having to adapt and figure those things out to do business locally, that's going to really expand and open the doors for us to to be able to use those same techniques globally. But as well, it makes us responsible global citizens, right? As we take these safety measures to stop the spread of COVID and stop the spread of the pandemic, then that really makes us responsible global citizens. And I think it also speaks to whoever your client or consumer base is going to be, as well as your employee base. I mean, we know with young professionals, and that's a huge thing, that they want to know that the company they're working for is service minded, is safety minded, is going to care about those things. And so I think that really, is going to speak to the younger, the young entrepreneur, the young professional and employee as well. When we focus on adapting to and adopting those safety protocols and those new technologies, those new business models that allow us to do that.
Very, very nicely said. And you are mentioning some key words that I'm picking up, and I'm taking notes on this, because I think this is going to be fabulous for young entrepreneurs to know. And you mentioned about global citizen. You mentioned about mindset of service, and you mentioned about how to use technology, and how to become new ways of evolving business in a global scale. And Juliana can add that to add few more when you were not online with us. And that is fabulous. She mentioned few of the companies that are doing and also contributing in how to change and evolve in this global scale. And when we are faced with a lot of other challenges, because young entrepreneurs do face many challenges different than regular entrepreneurs. And this is opening many doors for them and many opportunities. So Juliana, do you want to add anything to that?
I think she said it well. I think we're almost running out of time here, but maybe we can talk a little bit more about that in our next session this month, talking about COVID. So Shannon, what is kind of your vision about going forward in consulting with COVID, and how maybe can someone reach out to you if they're interested in getting more information?
Definitely. Thanks. So yeah, so as I said, I really had the opportunity this year with my disaster relief team to get into health organizations, hospitals, clinics, and help them figure out, how do we apply the principles we know about infection control in this new context and keep our, our staff and as well as our patients, which would equate to the client, right, safe, and really letting them know they're safe as well. And so, there's a few big things. I'll just throw out pointers if, for those of you that are, looking for those ways. You have to have protocols in place, applying those things that we know about COVID. You have to make sure that they're being applied, that culture of safety that I mentioned earlier, applied and enforced, and that especially keeping sick employees at home, ways for them to do, work from home is really big. And then, just really, again, sticking to those and seeking expert advice. So as I've come home from doing those advising jobs around the world, I've really seen a need and an opportunity for people to continue to improve in their adaptation of this, both in the healthcare field and in the business world. It can be really difficult to figure out how these principles, basic principles apply to your unique business context. And I've seen some of them applied really well, and some really full-hearted attempts that kind of fall short. Sometimes we kind of apply what feels right versus what the science really supports works. And so that's where, seeking that expert advice, I think, is really helpful. And so as you're looking, how do I reopen my business safely? How do I re-expand, my services in the current context? I would love to help you figure out how to do that. How do I communicate to my client base and my staff that I am doing these things so that they feel safe? I would love to be able to help you do that. You guys can definitely look me up and connect with me on LinkedIn. Shannon Hamilton, or reach out to me by email. So that's SEHAMILT@yahoo.com. And, love to discuss further if there's a way that I can support you in that safety and service-minded business.
It's very, very nicely said. And I'm so excited that you came and gave us an insight from the futuristic viewpoint of young entrepreneurship. And also a pandemic, like a global pandemic like COVID. Not only COVID, you also talked about Ebola, and you have mentioned many good topics that we need to explore in future, Juliana. Mindset of service is one of them. She also talked about culture of safety. She also talked about global citizenship. How do we build that in future? And then using technology to be adaptive and creative, and at the same time using expert advice. So many good things you are bringing up, and I would love to have you back again, and I'm pretty sure Juliana will set that up for us. So today our time is over, so we are very thankful for your service and very grateful for all the heroes out there, including our healthcare workers, our safety workers, and our grocery workers, by the way. They've been working very hard during this time. So I thank you. And Juliana, if you want to wrap this up, then we can hope to see you again, Shannon. And thank you for coming.
Yeah, thank you guys so much for having me.
Yeah, thank you so much for taking your time to be with us today and share your experience. We loved hearing that. And yeah, hopefully you come back and join us.
Okay, and that was a great way of starting our first episode of Young Entrepreneurs Building the Future of Business. And we will be doing many more in upcoming days and years. And Juliana will help us with that. And I'm pretty sure Shannon will be involved with us and help us grow this. Thank you very much. And we will see you next time.
Thank you.